excited to present the Keynote 695 presentation, which is a clinical trial. It's a single-arm phase 2 trial that looks at patients who are PD-1 refractory. And so we presented data on the first 56 patients on this trial. And the plan is to enroll 100 patients, and the rest of the data will be presented once we have adequate follow-up on the patients. But what we presented at SITC 2020 was on the first 56 patients treated. And so for this trial, basically, patients had to have metastatic melanoma, could be stage 3 unresectable or stage 4. And we were very careful to make sure that patients were PD-1 non-responsive. And so for that, you had to have at least 4 doses of an FDA-approved anti-PD-1 agent, progressive disease according to RECIST 1.1 on the PD-1, documented disease progression less than 12 weeks of the last dose. So basically, you couldn't have had PD-1 responded off treatment and then progressing at the time of study entry. You had to be actively progressing on treatment. And also no intervening therapies were permitted. So again, you couldn't have had PD-1 or ipi/nivo progressed and then been on another type of treatment and then go on this trial. And the reason for these rigorous controls was basically just to make sure that when we are calling somebody a responder, it's not because they had a ongoing response to their PD-1 drug. So we wanted to make sure that patients had progressed. And the primary outcome measure here was objective response rate by blinded independent central review based on RECIST 1.1. And secondary outcomes were our response